it's Paul. Let's look at a couple of examples of thyroid papillary carcinoma. So this is the most common malignancy in thyroids, and it has quite a number of distinctive characteristics. Just have a look at the histology first. It's just quite distinctive. So remember this papillary pattern, like a branching staghorn coral growth, and each of those little papillae have a connective tissue stalk running up the middle of them and vessels. This is an area where it's invading all these little branching fibrovascular cord groups. So I'm just running up there. There's a fibrovascular core quite nicely on display with vessels. If we look at higher power, there's very distinctive nuclei in these that have that empty or FNA appearance to them. Notice how they're palisading in a kind of overlapping pattern around the outside of each of these connective tissue stalks. And each of those is branching. This is an area of thick colloid there, that material. And then the papillae below it, you can see, and in fact a few of them, you can see blood vessels running through the supporting stalks like here. Let's look at cytology of a couple of cases, and here you can see these are usually highly cellular. So remember the breast papillary cancers I said were always highly cellular, so are these. You can see the same architecture we were looking at in the histo here with fronds of epithelial follicular cells, and then a lot of them are arranged like sheets, but notice that rounded branching appearance. And then this is a diagnostic area here with that connective tissue core that runs inside those papillae. And this is that fibrovascular core we were just looking at histologically. So remember we looked at these in breast as well. Notice how they're rounded and the nuclei are palisading around the outsides of the groups here. So fibrovascular cord papillary groups won't always be seen in papillary carcinoma of thyroid, but probably half or so cases. The other features that are very crucial are nuclear changes. So notice these nuclei have fairly pale chromatin. I'm just pointing out some grooves that are running longitudinally through the nuclei. Notice most of them have little nucleoli that are peripheral usually, so they're not central. And there's a very sort of fine sameness to them. Also here is a intranuclear cytoplasmic inclusion, that rounded area. So it shouldn't be clear, it should be the same color as the cytoplasm. Maybe some more grooves in some nuclei here. Another intranuclear cytoplasmic inclusion there. They can be a little tricky to spot sometimes, but once you see one, you usually see quite a lot. There's possibly another one there. This is another one. It's got spectacular fibrovascular cord papillary arrangements. Notice that connective tissue I'm pointing out there, and then the palisading of nuclei in these branching fronds around the outside. Just a bit of a higher power, you can see that palisading quite well here of the cells around the outside of the group, and again just here. Notice how large these tissue fragments are, and often, like in breast, you can see these macroscopically on the slide after it's been stained. Nice branching fronds there, and look at that sort of palisading of crowded cells around the outside. And finally another fibrovascular cord group. And just another example, so high power of the nuclear changes, intranuclear cytoplasmic inclusions. Notice that powdery, pale chromatin. Another group, again, you can just see the little INCEs arranged there. Just another incidental finding you often see is multinucleate giant cells. So these are just multinucleate histiocytes. They're part of the cystic debris that you commonly see in the background. And that reminds me, so one of the most common causes of false negatives in thyroid is intracystic papillary carcinoma. What you see is this. So this is like just a cystic background. It's got hemosiderophages, debris, macrophages in it. And in most sites like breast, you can pretty much relax when you see this appearance because it is going to be benign. But in thyroid, you have to stay quite vigilant for any groups of cells that could possibly be epithelial. Here we've got some cohesive cells. They seem to have definite cohesion, bit of nuclear variation probably there too. So it's very important to check out these groups and look for any of those nuclear changes, INCEs, grooves, some moment bodies, and this won't photograph well, but I think there's a couple of suspicious nuclei here that probably have INCEs in them. And in fact, the histology for this case looked like this. So we've got some normal, variably sized thyroid follicles here, full of colloid. Just tracking along here, there's a cyst, and this is the sort of attenuated epithelium lining that cyst. It's quite large, and if we track around in it, there's an area of just little focal papillary carcinoma on the edge of the wall. This material on the right is calcium, and then we've got a little papillary carcinoma here showing that typical branching form. So that's something you've got to be really alert for. So in summary, thyroid papillary carcinomas usually produce FNAs that are highly cellular. The classic arrangement is papillary fragments with fibrovascular cores that are branching and have palisading, overlapping nuclei around the outsides of the branches. They will be seen in about half of cases. In other cases, you'll just see highly cellular specimens that have very cellular sheets. And typically, you will see nuclear changes, and these are the key things really. Intranuclear cytoplasmic inclusions, nuclear grooves that run along the longitudinal part of the nucleus. Colloid can be present and is usually present in fairly thick blobs. These are usually cystic tumours, so the background will often be full of debris and hemosiderophages and macrophages. And some bodies I didn't show you in this case, but they can be present as well.